In one of her first updates, Alberta's new Chief Medical Officer of Health says the worst of Alberta's flu season is now behind us. The predominant strain of the flu, influenza A, hit its peak on December 31st with nearly 1,000 people in hospital. Now the province says it's seeing fewer hospitalizations as well as declining number of positive tests. But the sustained pressure on the hospital system this season has doctors concerned for capacity for future flu seasons, despite the province saying it added more than 300 surge beds.
So when you get flu suddenly causing 3,000 more hospitalizations, which it did this year, you're putting it on at an already overburdened system. So if the Alberta government is prepared to actually invest in people and the space and the physical surroundings necessary for emergency departments, then that would be the major thing that they could deliver on.
Another factor this year, doctors say that the vaccine was not a perfect match to the flu strain and say that they now have a new respect for the common virus.
I've developed a new respect for influenza. When I had a patient personally that had waited in the waiting room 8 hours before being seen, and within a couple of hours of being seen, ended up intubated and in the intensive care unit. Young, healthy fella that came down with influenza A got sick real quick and became septic.
Now, just because we are past the peak, it doesn't mean that people won't still get sick. The province does say it is still expecting a peak of influenza B cases and RSV, although they do say that it won't be quite as serious as influenza A. Now, the advice from the Chief Medical Officer of Health as well as doctors is to stay home if you're feeling sick. Call 811 to talk about your symptoms and to get vaccinated to help avoid serious outcomes.